This is our last community discussion for this school year. We've been doing this for 2 or 3 school years now. So it's always amazing to me when we get to the end and I feel like we just started. And I know anybody with kids or anybody working in schools is feeling that whiplash of May as they head towards the end here. May is also Mental Health Awareness Month, and a time when a lot of us need to take a deep breath and slow down. So I think it's a timely topic tonight that we're talking about mental health. For those of you who I haven't met yet, my name is Jackie Davis. I worked on the Let's Talk booklet with Marin Healthy Youth Partnership, and I get to be here with you all as we have these discussions together. So tonight our conversation is indeed about mental health. A lot of you might have seen over the past months some of the reports out of the CDC really raising red flags about the mental health of our young people, in particular our teen girls and LGBTQ youth, but really teens across the board, where we're just seeing just declining rates of mental health and well-being. And it feels like we're really at this critical juncture. And I know that it doesn't take data for parents and school staff and community members to feel that, right? That there's something going on. And we know that mental health impacts substance use, and substance use in turn has real consequences for mental health. So I am really, really grateful that we're here tonight to end this school year series with this most important and pivotal of topics, and something I certainly care a lot about. A couple housekeeping notes before we get started. If you're able to, please turn on those videos. We love to see you. We do have a chat function that's for questions and positive, supportive comments only, please. We will have a Q&A session at the end, though. So certainly you can hold on to those questions and we can do that. You can put questions in the chat box. You can also just unmute and go ahead and let us hear your voice. We love that. We'll also, just a heads up, be posting a link to a post-event survey. Please participate. This is what helps us craft this series for the following year to make it relevant and useful to you. And if you do it, we also place you in a lottery for a $25 DoorDash gift card, which is always great. I'm going to pass this on to Lisa briefly for our group guidelines, which we always share and really appreciate having. Lisa?
Thank you, Jackie. Hi, everyone. We all know parenting is not easy, and parenting around substance use issues is hard. There is no silver bullet, so we try to give you information that you can incorporate it into your parenting style to do the best job you can. We are all learning together. Please do not blame yourself for anything that you did or didn't do based on what you learned here today. Let's make this a safe space to share ideas and learn while not judging others or giving advice. Keep anything shared confidential. Self-care is essential in our world now more than ever. So please join us for the full time if you're able. Jackie.
Thank you, Lisa. I'm so excited to introduce our 2 speakers. I say that so genuinely. We're so lucky to be learning with them both tonight. Our first expert is Dr. Emily Tajani. She's been with us before, for those of you who have been with us before and in previous years. She's trained at the Yale University Department of Psychiatry. She's board certified in 3 medical specialties, which are all relevant to what we're doing tonight: child and adolescent psychiatry, adult psychiatry, and addiction medicine. She's a member of the teaching faculty at UCSF, and she's currently consulting with SAMHSA's Opioid Response Network to help develop emerging substance use disorder treatment programs for youth. So I really can't imagine someone more fitted to be with us, and also local and knows Marin. So I'm really excited about that. And then our student speaker tonight is Sophia Demo, and you are all in for a treat. They're a sophomore at Novato High School. They're also an MHIP intern, and we're just so lucky to have what I will say is enormous creativity and wisdom from them with us this evening. So without any more from me, I'm going to pass this on to Dr. Tajani, and we're going to get started. And thank you and welcome.
Thanks, Jackie. I'm going to go ahead and share my screen, as I have some slides we'll be going through as we talk tonight. Everyone see that? Yeah, great. All right. Well, thank you so much for spending your evening with us tonight. I am excited to be here and have this discussion with all of you about this really timely and important topic. It probably won't come as any surprise to any of you that the mental health of our youth and really our nation at large is not so great and hasn't been for some time. Many of you probably saw the announcement a little over a year ago by our current general, Dr. Murthy, where he declared in a rare public health advisory that kids' declining mental health is the crisis of our time. This announcement was made about 7 years after he brought light to a somewhat similar and related topic, which is that of our nation's opioid epidemic. And at that time, he called on all physicians in the United States to work on tackling this epidemic of addiction and opioid overdose deaths. And then yesterday, kind of out of the blue, to me at least, it was a surprise to me, but very timely, he made another related announcement calling attention to our nation's epidemic of what he calls loneliness and isolation, and highlighting the many ways that loneliness and social isolation have harmed both individual well-being and societal health. And he outlined a framework to help our country reverse this issue and the harmful sequelae of isolation and loneliness. But sort of separate from all these headlines and professional announcements, it's highly likely that you or someone you love and know has personally struggled with a psychiatric or substance use related issue. These are amongst the most common medical disorders that we encounter. Around 30% of people will experience a psychiatric disorder at some point in their life, and around 10% of people will experience a substance use disorder in their life. So I just want to call attention to the fact, if this is something you're facing, know that you're not alone. Before I move on any further into the presentation, there's a few terms that I'm going to use frequently tonight that I want to define just to make sure we're all on the same page. The first is the term substance use, which I may refer to as SU for short. And with this term, I'll be referring to one time or more use of any addictive drug, irrespective of whether that use is congruent with or represents a use disorder or an addiction. And we'll talk more as we go on tonight about what an addictive drug actually is. The second term is substance use disorder, or SUD. This term refers to a medical disorder that is marked by persistent or ongoing substance use, despite the fact that use of that substance is causing harm to one's health and or life. And the more sort of lay term that people tend to use is addiction or an addictive disorder, but the clinical and medical term is SUD, substance use disorder. Lastly, there's this term psychiatric disorder, or I kind of prefer psychological distress, as really most psychiatric disorders represent symptoms that exist along a sort of a spectrum. And there's a point at which we make a determination and have a cutoff that we will call this a disorder. We usually make that determination when the symptom, which is largely an emotional, cognitive, or behavioral symptom, begins to cause significant distress and impairs functioning. So let's look a little more closely on what exactly has been happening in regard to mental health of youth, both locally and nationally. Even before COVID, really beginning soon after the turn of the century, the mental well-being of youth began declining progressively year after year. This data is from both California and kind of shows how California compares nationally. Really, there's no major differences. And what we see is that between 2004 to 2007, and about 10 years later, 2016 to 2019, right before COVID, there was a near doubling in the rate of adolescent past year major depressive disorder. So the number of teenagers in California and nationally who experienced a depressive episode in the last year nearly doubled during this 10 to 12 year period. Rates of death by suicide also started increasing around 2007 after a period of relative decline, and continued to increase. I may have said decrease a minute ago, but it began increasing year after year between 2007 and 2019. So even before the pandemic, this was an area of growing concern. And then COVID came along, and the pandemic really just accelerated this youth mental health crisis. In 2021, around a third of high school students nationally reported persistent feelings of sadness or hopelessness over the past year, and around a quarter reported seriously considering suicide at least once during that year. The number of teenage girls presenting to emergency departments for suspected suicide attempt increased 50% between 2019 and the same period in 2021. I want to highlight the fact that these growing rates of psychological distress and the crisis that our youth is facing is really not an individual problem. This is really a community issue. And our Surgeon General, Dr. Murthy, highlighted this in his address last year, in which he stated young people are facing these devastating mental health effects as a result of challenges experienced by their generation. And like with most chronic medical illnesses, and especially psychiatric and substance use disorders, it is almost always a result of some sort of problem with fit between the individual and the environment that they are in. That is how disease arises, through a complex interplay between individual and environment. So there's something happening at a societal level that is driving this epidemic, and this cannot be explained simply by some sort of change with the individual. So there's a lot of different theories out there, some supported by evidence, to help explain why our nation's youth is experiencing this crisis in mental well-being. Again, like with most chronic illnesses, the causes are usually multifactorial. There's a variety of different risk and protective factors that interact and result in changing rates of chronic illness in a population. But one that was highlighted in a recent pediatric journal article is this idea that there really has been a decline in independent activity, and that may be one of the major driving forces based on their review of the evidence here. So, kind of the chronic overscheduling of youth and the decreased opportunity or ability for free play. By independent play, we don't mean playing alone. We mean children being out there in the world sort of without adults having fun. As the Surgeon General highlighted yesterday, there has been a really dramatic increase in the amount of time that people spend each month alone, socially isolated. Exponential increase since 2019, even before COVID. But compared to 2003, people are now spending about 24 hours a month alone, more so than before. And then, another likely driving force here is the fact that there is really easy access to habit-forming activities that do not support the development of the skills, the tools that allow for emotional well-being and resilience, things like social media, other forms of technology, sort of the fracturing of our civic engagement and fracturing of our sort of feelings of community connectedness, at least in certain regions. These are all potentially harmful forces, at least in certain contexts, that make it harder for young people to develop things like interpersonal skills and emotional regulation abilities and healthy lifestyle habits. These are strong, potent forces that are hard to resist. And the more they are sort of out there and freely available, the harder it is for young people to develop the healthy habits they need. So I'm going to shift now and talk a little bit more specifically about substance use and substance use disorder related trends that we're seeing amongst youth. Here, fortunately, I have somewhat better news. There are some areas of concern, and I'll get to that in a minute. We have actually seen really stable rates of past year or occasional substance use in youth, particularly amongst high school students. So you can see in this graph here that past year use of any illicit drug in 2020 compared to all the way back in 1974 really hasn't, it's lower than it was in the 70s, and over the past couple decades it's held relatively steady. So there are some things we're doing right, and this is good news. We have seen particularly positive changes in the area of past year alcohol use and binge drinking use amongst high school age students, with really historic lows and rates of past year alcohol use. When it comes to substance use disorders, we also see relatively steady trends, especially in recent years. And here we're talking about all types of substance use disorders, whether that's alcohol use disorder, methamphetamine use disorder. Substance use disorders as a whole have not changed much one way or another. Young adults are still the age group that is most likely to be experiencing a substance use disorder. about 15% of young adults will be diagnosed with a substance use disorder in the past year, and that's quite a bit higher than what we see in adults and teenagers, but at least that rate is steady. So how about the areas of concern? The first big area of concern is that even though substance use disorder rates hold steady and rates of past year use, including rates of past year opioid use, particularly prescription painkiller use, have been declining, at least for teenagers in recent years, the number of individuals, both adults and teens, who are experiencing accidental drug overdose death is climbing and continues to climb year after year. And very concerningly, in 2020 and 2021, drug overdose deaths amongst adolescents, more than doubled. And this was the first time in history that we saw an exponential increase in the rate of overdose deaths amongst teenagers. Historically, that rate has been very low and steady, and this increase is largely driven by more dangerous drugs, not more frequent drug use, but the fact that the drugs out there on the market are much more potent, more unpredictable, more dangerous. It used to be relatively uncommon in generations past that someone would be likely to experience an overdose death, upon first or second or third drug use. It was more of an issue once people developed tolerance and moved to using higher dosages of drugs. But now, sadly, and it's very frightening, is the reality that even one-time use of a drug, even a drug that may not appear to be that dangerous, may not be maybe different than what it's being sold as, can result in death. So it's a very dangerous landscape out there these days. The other area of concern is that there are a couple types of drugs whose use has really increased markedly, particularly among young adults. We're seeing really historic highs in past year marijuana use and hallucinogen use amongst young adults. And even more concerningly, we're seeing really large increases in the number of young adults who report daily marijuana use. And the reason that's so concerning is daily marijuana use is associated with great potential for harm and high likelihood of developing a cannabis use disorder and all the harmful sequelae that come with that, compared to, say, once in the past year use. So between 1994 and 2014, we saw a tripling in the number of college-aged youth who reported using marijuana daily. And then, not surprisingly, we also see amongst all age groups really dramatic increases in the number of adults who are experiencing a cannabis use disorder. So how about with Marin County? While there isn't as much county-specific data as we have sort of on a national level, we do have some. And this table here is taken from a report that was done by an epidemiologist at UCSF a couple of years ago. You can find that online, that looked at how Marin County youth were doing on certain indicators of past year and current substance use compared to California youth at large. And what he found, probably not surprising to many of you, because this is fortunately something that's been brought to light by this group, is that Marin County youth are using a lot more, especially older teenagers are using a lot more than California youth on average. And this is true for lifetime and current alcohol use, marijuana use, and other drug use. So what is going on here? How do we make sense of why certain drugs become more popular over time, and why rates of certain substance use disorders fluctuate, particularly generation to generation? We have a lot of data to help us make sense of this, and there's two main factors that tend to influence the likelihood that a person, particularly a young person, is going to begin using a substance and then is going to continue using it frequently and perhaps eventually develop a substance use disorder. And those factors are, number one, drug availability. We know increased availability and ease of access of a drug is directly and proportionally associated with rates of SU and SUD in a population. This is why alcohol is the most commonly used drug amongst youth and adults. It's very easy to get, and it is also why alcohol use disorder is the most common substance use disorder in our country. Another important factor is this idea of perceived risk of use of a specific substance. So the degree of potential harm that youth perceive use of a substance to sort of come with is inversely and proportionally associated with rates of substance use and substance use disorder in a population. So you can see on this graph here, this really quite perfect mirror image in which when the perceived risk of using marijuana declines, because this sort of changes over time and is the result of many different factors and influences, the amount of past year use tends to increase. So people use drugs more often when they perceive use of that drug more risky. And again, there's a lot of different powerful forces, many of them sort of market forces at play that attempt to influence the public's perception of risk that comes with use of a certain drug, whether that's alcohol, marijuana, or opioids. And many of these forces do not have you or your child's best interest in mind, unfortunately. Knowledge is really powerful prevention. Once someone has progressed to the clinical disorder of a substance use disorder, an addictive disorder, knowledge alone is less likely to be helpful, but it can be really powerful as a preventive approach. And that's why the Let's Talk booklet, I think, is so wonderful and such a great resource for our community. So if you haven't checked that out, I really encourage you to do so. So this is just another sort of attempt to highlight that there are some really powerful forces at play that want to influence and frankly kind of manipulate our sense of the degree of benefit that tends to come with using a substance. So it really doesn't matter, again, is it the alcohol industry, the vaping or cigarette industry, or even the prescription painkiller industry. They will kind of say and do whatever it takes to sell more of their product, because the bottom line economically is really where their mind and heart is at. So we need to, I think, support efforts that effectively sort of push back and limit the ability of these interests to influence the way that our communities sort of think about substances. Regulations can help, and even just sort of having conversations and modeling, sort of the reality of what the good, the bad, and the really concerning is that can come with use of these substances is really important. And it's never too early to start having those conversations as a family. Role modeling is also a very important aspect of this preventative messaging. As I'm sure you all know, it's more impactful to do as I do, not just do as I say. So again, really important from a young age, but particularly as your children approach the middle school and high school years, to make sure you're doing what you can to model that there are lots of ways to have fun, meaningful, exciting lives that don't need to revolve around using substances. And if you're having trouble doing that, which you might, because again, society doesn't make it easy to kind of resist these forces, I encourage you to get whatever sort of support or resources you may need. We know that children do better when their parents are doing better, and often an intervention aimed at a parent where parents are able to get the support they need can be highly effective at helping that youth in regard to their mental health and substance use outcomes, even when the youth is not directly involved in that sort of prevention, or sometimes even in that treatment. And while there's professional resources available, and I encourage you to make use of those if that feels appropriate, there are also a lot of good resources online. There's a great book about when a parent is depressed that has some really good advice about how to sort of broach this issue as a family and what you can do to kind of minimize potential harm to your child and also take care of yourself at the same time. We know that interventions aimed at helping parents reduce their own substance use yield great outcomes in the next generation in regard to that generation's risk of developing a substance use disorder. And even if you're not at the point of having a clinical disorder, but find that you may be struggling to implement and stick to healthy lifestyle habits and avoid even things like overuse of your smartphone, which also can be addictive. There's a great book that was published last year by Anna Lemke, a psychiatrist and addiction psychiatrist at Stanford, called Dopamine Nation, which provides a very easy read in how our brains sort of work and how the different forces out there in society can make it really difficult for us to feel as good as we possibly can, and what we can do about that. So those are just a few resources you may be interested in. Let's shift now to talking more specifically about what we can do to help our youth have better mental health and substance use outcomes. So first and foremost, I think it's important to recognize that psychiatric and substance use disorders, they tend to travel together, and they almost always have their onset prior to adulthood. Some of the most impactful risk and protective factors are those that are present early in life and sort of up to and throughout development, adolescence. And we know it's very unlikely that someone will develop a substance use disorder at any point in their life if they delay their first substance use until early adulthood, roughly, you know, around age 20 to 25. If people, the longer a young person puts off experimenting with drugs, the lower their risk of later developing problematic drug use. We also know that the vast majority of psychiatric disorders, whether they're anxiety, behavioral, such as ADHD, or mood disorders, such as depression or bipolar disorder, and even substance use disorders tend to first present, symptoms are first present by late adolescence, and rates of these disorders by late adolescence are very similar to rates we see in older adults. And earlier intervention is always associated with better outcomes. So if you're seeing signs of any of these symptoms in anyone you care about, it's always a good idea to reach out and ask for help. And you can start with just your primary care or pediatrician. So there's this term co-occurring disorders, which I don't think I said previously tonight, but this is just referring to the presence of both a psychiatric and a substance use disorder. Co-occurring disorders are the norm, not the exception. The vast majority of people, especially young people who have a substance use disorder, also have a psychiatric disorder, more than 85%. And in fact, 50% roughly have symptoms that are reflective of the presence of 3 or more psychiatric disorders. Since substance use disorders are more uncommon than psychiatric disorders, the reverse relationship is not true. So the vast majority of people with psychiatric disorders do not also have a substance use disorder, but they are at higher risk for a substance use disorder. And I have just sort of outlined here the psychiatric disorders that most commonly co-occur with substance use disorders. These include bipolar disorder, depressive disorders, anxiety disorders, ADHD, borderline personality disorder, eating disorders, and trauma-related disorders. And the direction of the relationship can go either way, and that having one can increase, any one of these ones on the outer circle can increase the likelihood and risk of developing the substance use disorder, and having a substance use disorder can increase the likelihood of developing or experiencing a worsening of symptoms of any of these psychiatric disorders. So we know for sure that youth with psychiatric disorders are more likely to, at some point, also experience an SUD. And we also know that youth with SUDs are more likely to, at some point, experience a psychiatric disorder. And you can see on this bar graph here that youth who have a drug or alcohol dependence are more likely to have had a major depressive disorder in the past year, and vice versa. Now, you may be wondering, well, what's the direction of the relationship? Is this a causal relationship or not? And, you know, the sort of classic, is this the chicken or the egg question? And, you know, the answer to that is it can be the chicken, it can be the egg, or it can be something else entirely. So on the right here, you can see that one pathway that leads to this association between psychiatric and substance use disorders is the fact that there are common genetic and environmental risk factors that increase the risk of both of these disorders. However, it is also true that having a psychiatric disorder on its own increases the risk of later development of a substance use disorder, as well as the reverse. Having a substance use disorder increases the likelihood of later developing a psychiatric disorder. And if a psychiatric disorder is already present, prior to the onset of that substance use disorder, the substance use disorder can worsen the severity of symptoms and impair recovery from the psychiatric disorder. And so this is just outlined here, these three different pathways. We'll talk about each of these a little bit more here. So let's start with the first pathway, which is that there are common risk factors that contribute to a greater risk of developing both psychiatric disorder and progressive substance use and a substance use disorder. So some of you, perhaps many of you, are familiar with this term epigenetics. Epigenetics is the way that we currently think about heritable genes and environmental risk factors, the whole nature versus nurture debate. It's not really a debate anymore, because what we know from a lot of scientific research is that it's almost always both. We know that environmental exposures have the capacity to essentially modify our genome. What various environmental exposures can do is they can turn on or up, or turn off or down the degree to which our genes that we inherited at birth are actually expressed. And this is what is referred to as epigenetics. And so when it comes to the brain, there is constantly a dynamic interplay between our environment and our genome that influences the way that our brain is functioning, our neural function and structure, which in turn influences the way that we think, feel, and act. And while epigenetic effects are possible at any age, even older adults can experience changes in gene expression as a result of various environmental exposures. Young people are much more sensitive to and susceptible to their environmental exposures. And this is because the brain is highly plastic during early childhood and again during adolescence. Despite sometimes common thinking to the opposite, to the contrary, which is sometimes there's this idea that, well, you're young, you're naturally resilient. That actually is not true. Adolescent brains have greater upside and greater downside potential. So when there's healthy exposures happening, that brain develops in an especially healthy manner, and healthy thoughts, feelings, and behaviors ensue. But the opposite is sadly also true, in that when there are a plethora of unhealthy exposures, especially if they're not balanced by some of these protective factors, then we see more concerning epigenetic changes. In this table, I'm not going to have time to go through all of this, but if you're interested, you can reference it later. I've just listed some of the most well-validated risk and protective factors for both psychiatric and substance use disorders. And as you can see, while there are some that are specific to the individual domain, most of these are more broader and sort of community-based. There are school-based risk and protective factors, family-based risk and protective factors, and importantly, community-based risk and protective factors. So there's a lot of different ways, pathways by which we can increase the protective factor exposure and try to reduce the degree of risk factor exposure for our youth. Okay. We're going to talk in a little more detail about the second pathway, how it is that substance use and the presence of a substance use disorder can contribute to psychiatric illness. I think this is a pathway that may be less well understood than the previous one and the one that we'll talk about after this. So in order to really appreciate why it is that substance use and the development of a substance use disorder can worsen or even cause psychiatric illness, we need to understand just a little bit about the brain. So I'm going to try to not get too much into the weeds, but cover a little brief lesson in sort of neurobiology here. First and foremost, we all need to recognize that we are all capable of developing addiction. Sometimes we hear about an addictive personality, and while there are certain genetic and environmental exposures that can increase the one's susceptibility to addiction upon exposure to an addictive drug, anyone can develop an addiction if sufficiently exposed to an addictive drug. And that is because we all have this pathway in our brain called the reward pathway. It's very old, evolutionarily important. We'll talk more about that in a minute. But this is the pathway that involves this part of the brain called the ventral tegmental area and the nucleus accumbens. And when an addictive drug is consumed, there's a large burst of dopamine released into the nucleus accumbens, which then connects to three very important parts of our brain: our prefrontal cortex, which is our decision-making, judgment, executive functioning center; our amygdala, which is our emotional center. This is the part of the brain that is involved in emotional regulation, mood, and anxiety; and then our hypothalamus, which is the part of the brain involved in learning, memory, and stress response, stress resilience, or reactivity. And so while there's tremendous inter-individual variability at which a threshold dose of substance use will result in a substance use disorder, um, and this explains why some people can get addicted to a substance with a relatively low level of exposure, or may progress really quickly from occasional use to more frequent use. And for other people, it may not be until they're older in life and they're given prescription painkillers for long periods of time, thinking it's going to help, not recognizing the risk. But like at that point, changes in the brain have occurred and addiction can set in. And it can be hard to predict. It's really impossible to predict ahead of time what one's threshold dose is. And that's why it's important to minimize and delay as much as possible. So a little bit more about the reward pathway. The reward pathway is a neural circuit that connects parts of the brain involved in memory, emotion, and behavior. Stimuli that activate this circuitry, and they activate it by precipitating the release of dopamine along that pathway that I showed you in the last picture. These stimuli are treated by the brain as if they should be repeated. So when we encounter something, whether it's a natural reward, which is things like food, friends, love, sex, even caretaking, parenting, these are all activities that activate the reward pathway, and which, from an evolutionary survival perspective, are important behaviors to be engaging in. That's why this pathway has persisted for hundreds and thousands of years. But sort of by an accident of nature, addictive drugs also can activate this pathway. But when we encounter a reward in the environment, whether it's a natural reward or a drug reward, this pathway becomes activated, it lights up, and that teaches us, it tells us, our brain tells us, that was important, let's do it again. This pathway is not what mediates pleasure. It's not what mediates the high of the drug. There's a wide range of drugs. A cocaine high is very different than an opioid high, is very different than a cannabis high. But all of these different classes of drugs can result in addiction through the same exact brain mechanism. The same neurobiology is at play. So what drives addiction is entirely distinct from the high or the pleasure involved. And so that's really how we define an addictive drug. You can see a few listed here, and you can see that they sort of exert their effects, their high, through their actions on a wide variety of neurotransmitter systems and circuits. But what they all do is they cause the release of huge amounts of dopamine along this pathway at a level that is far beyond what any natural non-drug reward can elicit. And I think it's important to also recognize that psychotherapeutic drugs largely do not activate this reward pathway. They do not work via this pathway. Antidepressants, many anti-anxiety medications, mood stabilizers, etc., do not have the same effect on this pathway, and that's why they are not addictive and tend to be therapeutic. So essentially, in a nutshell, this is sort of summary. Addictive drugs, because of the fact that they elicit a large burst of dopamine release along this pathway, become experienced by the brain as more important than natural rewards. Over time, with recurrent drug use, the brain begins to shift its attention and behavior towards seeking out and obtaining these drugs. And then there is a narrowing in the things that are wanted and are seen as important to pursue, because natural rewards, things like hanging out with friends, working towards some sort of work or school goal, doing things to help others, engaging in fun hobbies, all naturally rewarding activities in the absence of an active addiction, become relatively less rewarding and less frequently engaged in over time. Another sort of cruel biological reality when it comes to addictive drugs is that the pathway by which drugs result in the high, which is often at first experienced as fun, desirable, pleasurable. That's why people do the drug more than once. That pathway, quickly people develop tolerance to that effect. So over time, there is less of a high, less pleasure that is experienced with each subsequent drug use. Now, the reward pathway is not subject to the effects of tolerance. So people continue to want more and more and more of the drug with each use, but feel less and less pleasure with each use. And you may have heard people say it's never as good as the first high. And this is why. So addiction really, it's about wanting, it's not about liking, it's not about hedonism or pleasure. There's progressively more wanting over time with each subsequent substance use and less liking. So essentially free choice becomes constrained. Oops. There we go. And what's also happening behind the scenes is that this recurrent drug use, because it results in such large bursts of dopamine, far beyond anything that a natural reward can produce, and far beyond what the brain expects to encounter, it throws the body's and the brain's balance out of whack. And the brain is no longer operating in its homeostatic range, and the brain and body, it doesn't like to be outside of the homeostatic range. It puts too much stress on the biological and physiological systems. So this elicits a biological stress response, which turns on certain epigenetic processes, which ultimately result in a disease state. In this case, with substance use, that disease state would be the substance use disorder or addiction. And so, with time, people stop using to feel good. They just use to not feel bad. So this idea that they're using to get straight, not to get high. People's with prolonged periods of substance use, it becomes almost necessary to keep using in order to just feel normal again, in order to feel the way that one felt and be able to function somewhat near the way that one felt before drug use began. But because of the many different ways in which recurrent drug use can affect the brain and the body, it's not even possible to reach that previous state. The areas of the brain that become most disrupted with recurrent drug use, that are most subject to the epigenetic effects of recurrent drug use, are really important parts of the brain. And again, this is the executive functioning center, the mood center, or the amygdala, and the part of the brain that helps us learn how to cope effectively with stress. So these all become impaired, and people develop worse cognitive and decision-making capacity, lower mood, more anxiety, and decreased ability to cope with stressful situations. The adolescent brain is especially susceptible to these drug-induced changes in brain structure and function. So use at a younger age, especially when that use is persistent, results in more long-lasting and severe impairments in these parts of the brain, making it harder for people who begin using at an early age to recover. So this is why there's really no effective way to self-medicate, at least from a psychiatric or cognitive standpoint, over the long run with an addictive drug. So on this graph here, you can see on the right the neurotransmitter systems that become disrupted with recurrent drug use, and the way in which an individual's sort of baseline mood state, but this could refer to stress, coping, or executive functioning, becomes progressively lowered with progressive substance use. So the baseline gets worse and worse over time, particularly during periods of abstinence. So really, what drives addiction and can make it so hard for recovery to occur in the absence of treatment is not that first week or two of experiencing physical withdrawal. That's actually easier for a lot of people to get through than this more persistent impairment in emotional state, cognitive ability, and behavioral acts. And so it's really this protracted withdrawal period, which can last usually a month or to several months, that is really what drives the recurrence, persistence, and relapse that is commonly seen in addictive disorders, at least in individuals who are not receiving support and treatment. I think the brilliant but sadly late author David Foster Wallace put it best when he said, "Addiction is when the drug offers itself as relief from the very problem it causes." Okay, we're gonna very briefly talk about this third pathway, which I think people are more familiar with, the idea of self-medication, or that mental illness can contribute to substance use and substance use disorders. So I think the important point here is that not everyone starts with a level playing field due to genetic factors or environmental exposures, such as childhood trauma. Some people start out with sort of a lower baseline or certain vulnerabilities and regard to their baseline mood state or cognitive functioning or their ability to deal with stress. And this can make it more likely that people will use substances repeatedly and will struggle on their own, at least, to recover or stop using substances once a substance use disorder has started to develop. And we see this really with every drug, but I have here just an example in regard to cannabis use. So we know that youth who have depression are more likely to initiate cannabis use at a younger age and are more likely to progress more quickly from occasional cannabis use to more frequent heavy cannabis use, and in turn to develop cannabis use disorder than youth who have not had symptoms or a diagnosis of depression. And we have been seeing especially large increases in cannabis use amongst youth with depression in recent years, perhaps because cannabis use has either become more widely accessible or there's decreased perceived risk associated with cannabis use and often messaging around cannabis being therapeutic. But really there is no indication that cannabis is indicated as a treatment for any psychiatric disorder. Okay. I have just a few more slides and be done with my portion tonight. What we're going to talk about in the last few minutes here is the fact that there's a lot of hope and there's a lot of potential for change if a person has begun to experience a psychiatric or substance use disorder. These are highly treatable and even preventable conditions. Treatment works. Treatment outcomes for substance use disorders are just as good, if not better, as the outcomes we see with nearly any other chronic disease, whether that's hypertension, diabetes, or asthma. I think sometimes people have this sense that addiction treatment doesn't work because of the fact that due to parity issues or stigma, addiction treatment is often stopped prematurely. So like with any chronic disease, treatment often needs to be long-term, at least for a period of time. People often can step down in intensity, but many people will need ongoing supports for their SUD, just like we see with, say, diabetes. When someone has diabetes and requires insulin, we don't decide to stop the insulin just because they've been taking it for a while. They need to continue on the insulin. It's a life-saving treatment. And that's often true when it comes to addiction treatment. We also know that prevention works. There's a lot of really well-described prevention models that communities can adopt. It's cost-effective and tends to benefit not only the group that's being targeted, but the children of those individuals. So it really makes sense to do what we can to try to prevent these disorders from developing in the first place. Here, I just want to show you biological evidence that recovery is possible. So you can see these brain scans of a healthy person, someone who is using methamphetamine, but has been recently using methamphetamine and is 1 month abstinent. You can see their brain looks quite a bit different. But at 14 months, the brain doesn't look that different than the person who never used methamphetamine to begin with. So the brain is incredibly neuroplastic, even in adulthood. And so sticking with what can be a long, slow path of recovery really does pay off in the end. We're not going to have time tonight to get into all the nitty-gritty of how you treat psychiatric and substance use disorders, but because there's a lot of misinformation out there, I just want to highlight some of the mainstay sort of evidence-based approaches. The general idea here is that earlier is better, often and ongoing is the way to go, and that treatment should ideally be delivered simultaneously when someone is experiencing a co-occurring disorder. So the old school approach was you have to get sober before you can benefit from mental health treatment. We now know that's not true, and the best treatment plans involve integrated psychiatric and substance use disorder happening simultaneously. While treatment really needs to be individualized, generally treatment for either or both of these disorders would involve some form of therapy, often family-based is best. There are a wide variety of medications that can be used to treat psychiatric disorders and that can be used to treat substance use disorders, not just the physical withdrawal, but that can be used in an ongoing way to reduce the potential for craving and relapse, say, months down the road during a stressful period. And then there's a lot of really effective environmental and social supports available. Rarely is there, well, I would actually say there's never a one-size-fits-all approach. Treatment really needs to be individualized. It's a process of figuring out what works for whom, and ideally should be a process that a family engages and embarks on together. While there are a few maxims as far as what's definitely not going to work, I can tell you that almost never there's two things out there that tend to not be helpful and potentially be harmful, and that is tough love or punishment-based approaches. They may work for a little bit in the short run, but rarely work over the long run and have the potential to result in worse outcomes. And short-term high-intensity treatment, this idea of sending someone away to a 30-day rehab has been shown repeatedly in the research to not be effective. At a minimum, we want to think about starting with 3 months of treatment if there is an active substance use disorder, and then taking it from there. Last little bit I want to speak to is, what do we do if we can't get professional help? Because I think most of us know it can be really hard to access psychiatric and substance use disorder related services. Over half of US counties do not have a single practicing psychiatrist. We're fortunate here in Marin that we have, much better ratio of psychiatrists to people than most parts of the country. But even here, it can take a long time to get off a wait list and get in for treatment. And nationally, fewer than 20% of youth in need of psychiatric treatment receive it, and less than 5% of youth who need substance use disorder treatment receive it. So I want to offer this message of hope by sharing a quote that a physician colleague of mine said once, which I found so accurate and poignant, which is this idea that to be with someone in the darkness that others fear or deny is the most powerful medicine. This may sound trite, but it really is true. Research repeatedly shows that curiosity and empathy is a highly effective way to help someone who's struggling with a psychological or substance use related issue. This is probably the single most important thing that I do in my practice, is to listen with curiosity and empathy, try to understand and to be there, alongside someone during their darkest times. Research shows that the most important thing a child needs to be resilient and achieve optimal health outcomes by adulthood is a committed, caring adult in their lives. So this is something that anyone can do or learn to do better. We should also really think of this as a community responsibility. We need, as a community, to create viable pathways toward mental health and wellness. And if anyone wants to learn more about this, about what we could do better in our own community here or really anywhere in our country, look to Iceland. Iceland historically had some of the highest rates in the world of past month drunkenness and cannabis use and other drug use. And a little over a decade ago, they brought in some experts to help with this really big problem. And as you can see on the graph here, they have achieved tremendous success through implementing this program they call Naturally High. You can look it up online. I sort of outlined here the main strategies used. It's really a program that focuses on encouraging family bonding, family connection, and time together, helping youth find their natural highs, so the natural rewards that are going to do a really good job of sort of competing with the potential to engage in drug rewards. So they've invested heavily in supporting youth and finding their interests and enrolling them in activities. And then they create guardrails as a community, things like a youth curfew, asking parents to commit to not serving alcohol or allowing drugs at parties, and providing resources as needed to support social, emotional well-being and skill building. If you are someone who's looking for resources to help yourself or a loved one with a psychiatric or substance use disorder, there's a lot of great free evidence-based resources online. I've listed 3 here: the American Academy of Child and Adolescent Psychiatry, Partnership to End Addiction, and the Center for Motivation and Change. Lastly, I just want to end on this note of kind of recognizing that it can really be hard to be to watch someone you care about, especially a child, struggle with a psychiatric or substance use disorder. And at times it can feel sort of hopeless because these are often long, slow roads of recovery. Recovery does happen, but it often doesn't happen quickly. But if you can remember that struggling with one of these issues or having a child who's struggling with this is not a sign of a personal failure. It is not a sign of any sort of inherent badness or brokenness. And sticking to the path, turning toward instead of away from the issue really is a sign of strength. And as Beyonce said, if anything was perfect, you would never learn and you would never grow. And I think, what all of us want for ourselves and our kids is to grow. And so there are many, many ways to grow and come out much healthier and much stronger on the other side of things. So thank you. And I'll be happy to answer any questions later on.
Thank you, Dr. Tijani. Thank you so, so, so much. I love that you ended with Beyonce. I also noted with, you commented about relationship. And I think every time we're together, we come back, no matter what the topic is for the night, we come back to the essential element of relationship, empathy, compassion, and caregiving, that's sort of one of the strongest tools that we actually have in this. So thank you so much. As we transition, I was thinking as Dr. Tijani was speaking about how in the Let's Talk booklet in our letter to readers, we talk about some of the tools that we have to do this work. And one of the tools was we have a lot of science now, which is so cool. And I feel like this exemplifies that. And then the next thing we say in that letter is that we have a lot of smart, funny, wise, creative, awesome young people with a lot of passion. And I feel like there's no better introduction for Sophia, who we're talking to next. And so tonight really does exemplify those two tools that we have. I'm excited about that. So Sophia, I am going to now pass this over to you.
Hi, I'm Sophia, and I wrote a poem that was inspired by one of my favorite poets called Warsan Shire. She's absolutely brilliant, and the poem can be read up and down to up. It's about addiction and mental health. This poem can start with a child walking back into a classroom. Sit at your seat and try again. That's how we bring you back. I can keep you safe, kid. It's going to be okay. And when your glass heart breaks beneath your brain, I'll tell you, you aren't alone. When your thoughts spin like ribbon around your throat, you aren't your struggles. My pen restarts this story. Just say it. You'll ask for help. You've been skipping class and fallen behind. Addiction keeps her blood-stained hands around your throat. I understand that you've been trying. This time people will hear. This time people will hear you've been trying. I understand that addiction keeps her blood-stained hands around your throat. You've been skipping class and fallen behind. You'll ask for help. My pen restarts the story. Just say it. You aren't your struggles. When thoughts spin like ribbon around your throat, you aren't alone. When your glass heart breaks beneath your brain, I'll tell you, I can keep you safe, kid. It's going to be okay, and that's how we bring you back. Sit at your seat and try again. This poem can start with a child walking back into a classroom.
Really
and then I
quickly,
wrote,
Sophia, before you go on, I just want to make it clear because you do such a wonderful job of explaining it's written in the style of another poet, but I want everybody to know that that is Sophia's writing. That is Sophia's poem. That's not them reading somebody else's. That's what they've created. I just want to make sure everybody really does know that.
Thank you. I wrote this poem to evoke how difficult it is to experience mental health and addiction problems, especially in an academic sense. Kids with addiction and mental health, as has been told, are much more likely to struggle in school, and they often fall behind their peers. And this is an issue that educators should be aware of and treat gently, because addiction is not laziness. Struggle is not laziness. I wrote this poem to put myself in somebody else's shoes and walk a mile with aching feet. And today, as I read this, I imagine wearing the shoes of addiction, like the kid sitting in my math class, like the kid that you know walking down the street, and like the kid who doesn't feel safe at home. And I wrote this poem to show that with supportive help, it can get easier to recover and to thrive. With a help system, teens are much more likely to get better from addiction and mental health issues. And with this support comes a possibility for real change. But not everybody has this support. And this isn't always because of neglect. It's often because people don't know how to support teens with addiction, especially parents and educators. They were never taught. That's kind of what this meeting is about too, for sure. And oftentimes when they don't know what to say or how to help, they're so afraid that they might get it wrong that they pull back and they don't act. But that doesn't have to be the way that it is. And I just wanted to tell everybody here that the kids in your life really appreciate it when you show up, and you don't have to act perfect and be some all-knowing figure to help somebody heal from mental health or addiction. So often people who are struggling, they just want to be listened to. They just want to have somebody show up for them. And all you really have to do is show up and try your best and listen to their needs. And don't be afraid to show support in a way that makes sense to both of you, even if it's not what you see on Facebook or Instagram or how other people are showing that they care about their kid. An example of this is my father. He's not always a man of words, and he shows love within his actions. And one night when he was braiding my hair, I asked him if my depression diagnosis had pained him as well. And instead of just talking right away, he stopped and he put his hand in the hollow of his heart and he said, right here, right here. And even though he hadn't said really anything or a lot, I understood that he cared about me. And some parents and some people, they talk a lot or they don't talk a lot. And all you really need to do is show that you feel their pain. And that's all anyone really needs. And it's all you can do. So, but it's enough. It's enough. And everyone here is enough to be able to do that. Thank you.
Thank you, Sophia, so much. I want to sort of reiterate sort of what you just said about showing up. I think that's so poignant. Excuse me, well, a couple tears here for anybody who's a parent on this call. I think sometimes fear can freeze us, Sophia, right? And I think what you've reminded us is that when you say you don't have to show up perfectly, you don't have to find the right words, you just have to show up. That kind of unfreezes us, I think. And so thank you. I think that's yes, very, very powerful, and some thanks for you in the chat there. And thank you for you showing up in, I think, a really unique way. We always have a young person with us, but in 3 years, I don't know that we've had anybody who has said, I'm coming to the table with my poetry and my creativity and my work. So I thank you for that. We have time for questions, comments, for Dr. Tejani, for Sophia, for both, for each other. And you can all certainly put that in the chat. You can also go ahead and unmute yourselves. I'm going to start with a question that came through to me while we were talking. I'm just reading some of the comments. I think this came through during Dr. Tejani's talk, but also, Sophia, if you have something to add to it, please do from your lens. It was while you were talking about perception of risk and how when teens perceive less risk from drug use goes up. And the question was, what impacts teen perception of risk, which I think is a great question.
Yeah, well, I think it's the two main things. One is the sort of behavior that youth are seeing others engage in around them, namely the adults around them. So when adults are acting in ways that may suggest substance use is not all that risky, then there's going to be lower perceived risk, and the reverse is true as well. And then, of course, there's messaging that is done more sort of overtly, often through advertisements. But also, some messaging maybe around how these drugs are obtained. Legal drugs often are perceived as having less risks. Pharmacologic drugs such as prescription painkillers can often, at least historically, been perceived as having less risk. There's this concept called generational forgetting, which is this idea that the most popular or commonly used drugs and addictions for one generation tend to shift in the next generation, because there's this sort of cycling of, increasing rates of substance use, and then substance use disorder, and then awareness. People witness in their own families or communities the harms of using that drug, and then the next generation that is kind of coming up under that time sees those harms and tends to move away from that drug. And we've certainly seen that with prescription painkillers, and that we're past the peak of adolescence increasingly using those drugs. But the problem is there is fentanyl and other very strong opioids and tranquilizers that can often be either easily accessed or sometimes included in other substances. And that's why we still see overdose deaths climbing. So people don't always have total control over what they're taking in or knowledge about that.
Thanks. Sophia, if you have anything to add about what you see as sort of your peers' perception of the risk of drugs or what impacts that, please do, but don't feel like you have to.
I feel like a lot of my peers, especially in Marin, I'm not sure about in other places, but in Marin, you really do get educated a good amount on drugs, because there's health classes, there's sex ed, there's sufficient things that include courses, not to the level that's needed. In Nevada,
yeah, it's different in all
Nevada, not to the level that is needed, but definitely to a level I think that would be more than a few other places. So I feel like a lot of the people around me, they often know many of the risks at least, but they were addicted young, or they've been laced a couple times, and it just makes it a lot harder to stop.
Thank you.
So that's kind of what.
Thank you, Sophia. That was great to sort of highlight that there is education and awareness happening. And I wanted sort of along those lines to add that it's important to be honest providers of information. So I am not suggesting that we only focus on the potential risks, or that we exaggerate those risks, because then we become unreliable sources of information. And that's the last thing we want, is for our kids not to trust us as adults. So, the discussion should really include things like, why do people use drugs? What are some of the things people like about drugs? And also, what are the harms? It should be a balanced discussion. And I think the Let's Talk booklet really is very, very balanced. We don't want to have sensationalized discussions. And we want to have these discussions from a very young age. It's never too early.
There was a question about recommendations on books or prevention programs. You mentioned Dopamine Nation as one of those books. Do you have other recommendations on resources, either reading or actual programs that are out there that might help with prevention?
Yeah, there's a program, let me see if I can, Raising Healthy Children or Healthy Communities. You can find information about it on the National Institute of Drug Abuse website. That is one of the most widely researched programs that found benefits in 2 generations, and it's a program that largely focuses on implementing resources and strategies in school and community settings that support the healthy development of youth and are effective at preventing substance use disorders. Much of what's effective when it comes to the prevention of substance use disorders is not about sort of drug education, like programs like DARE really don't work. It's more about supporting resilience building, focusing on helping youth develop good interpersonal skills and finding ways to be able to regulate their emotions and find rewarding activities in their communities that do not involve the use of drugs. I can't think of a book off the top of my head, but NIDA has great resources. They actually publish a guide that you can find for free online called Early Childhood Prevention of Substance Use and Substance Use Disorders, which goes back to even before the point of birth, strategies that families and communities can engage in to help prevent substance use disorder development later on in life.
Great. And there are a couple links going in the chat. One is for Raising Healthy Children. One was presented to us by one of our community members. I think, this question leads into this question about strategies for prevention overall. I would say being here tonight is one of those, and learning to communicate with our kids. Sophia mentioned education. My ears perked up, Dr. Tajani, when you said help your kids find what gives them their natural high. But if you could highlight, the strategy is going on, but if you could highlight a few of what you think are the most powerful prevention strategies. And Sophia, for you as well, do you think there's anything that you see that's been really powerful for helping young people not use or, yeah.
So, okay. Sophia, okay, I'll start. So I think, doing what you can to help your child develop social connections and to feel supported within the family setting and their school setting, that those are really powerful, helpful things. And then to be aware of areas in which your child may be struggling emotionally, socially, or academically, and approaching that in a non-judgmental, non-critical way, and trying to work together with them to figure out what might be helpful to ameliorate some of those areas of difficulty, and taking really a strength-based approach.
Sophia, do you want to add to that around prevention?
Yeah, I think that really great prevention is showing up as I said, but also like the friends that you have around you, because I think that oftentimes people who are doing hard drugs or have substance abuse disorders, if they're in a bad place, they often don't want other people to be in that place, at least that I've seen. So I guess what I'm trying to say is friends that don't pressure you and know the dangers into doing anything. And that doesn't just go for drugs, but it goes for sex, for schoolwork, for basically everything. Just having people around you that, no matter who they are, no matter how parents might perceive them, really are there for.
Yep.
For
and
the
Sophia,
kid.
the science supports you on that one. Our social networks matter for a whole host of health outcomes, in fact, including some of what you mentioned too. I love this question. Why do you think the rates of drug use, mental illness, I don't know if the mental illness are higher in Marin, but why do you think the rates of drug use certainly are higher in Marin than elsewhere in the state for our youth? We address this a little bit in our Let's Talk booklet, sort of like the what's going on here, but Dr. Tajani, what do you think is going on here in Marin?
Yeah, well, I think probably one of the most important impactful factors is that adult rates of substance use are higher in Marin than the rest of California. This does not necessarily mean that the rates of substance use disorders amongst adults are higher in Marin. They're actually about the same, probably because there's several protective factors present here in Marin that are not as present in other areas. One important one being that there are more services here than in other areas, and there may be, at least for some people, fewer of some of the social stressors that can tend to increase susceptibility to progressing from substance use to a substance use disorder. But I really think it's about, what youth are seeing in the community and the way in which messaging occurs around, that perceived risk. and it may also have to do with some of the pressures that can be unique to this community that we're in here, that may drive decreased fun social time and increase sort of performance-based work or activities that may not really be all that compatible with healthy childhood development.
I think in Let's Talk, we call that achievement culture, actually, as one of the things we've highlighted. I want to highlight, Sarah, thank you for your comments. I have heard about you. I'm so excited you're here, a substance use specialist in Novato schools, which is sort of a new and very exciting addition over in that district. So thank you for putting that information into the chat, and I hope to meet you someday. I have another question that came in directly to me. Someone who's curious at what point parents should consider psychotherapeutic medications to treat anxiety and depression, if that can then be almost like prevention to help prevent kids self-medicating, or what your thoughts around that are.
Yeah.
Great
So I
question.
think this should be approached through a discussion with your, healthcare team. You can start with your child's pediatrician or primary care doctor. They're often, the best first stop and the easiest place to first access services. And if the treatment need is beyond what they're capable of providing, they should ideally provide you with referrals and resources to someone with more specialized training who can help. But as far as whether to reach out and have that appointment or discussion with the primary care doctor to begin with, I think it really comes down to, how is your child distressed? Is their functioning sort of impaired from where it was before? Do they appear to be struggling? Do they feel like they're struggling? And if so, get help. It's again, never too early to get help. And your child's pediatrician can help with even having that discussion if it feels like it's hard to do at home. Sometimes there can be, tensions can run high when these topics come up for some families. So, bringing in sort of a neutral party can often be helpful.
Thank you. Someone commented that marijuana usage just seems so normalized at our high schools. I'm alarmed at that usage. It's so hard to monitor. It doesn't even smell. I'm at a loss. And I think that statement, I'm at a loss, maybe captures what a lot of us are feeling. So maybe that's more of a statement than a question, but for people who are feeling like this is everywhere, I'm having trouble monitoring it, I'm at a loss of what to do as a parent. Do you have any words of advice? And this goes to Sophia as well, by the way.
I think just establish a good relationship with your kid where they feel like they can tell you things. Because which everyone really is at this point, is at a loss because there's all this new stuff that, like, it doesn't smell, people can't tell, it's all of this. Then I think just instead of really closing in, kind of open up and be inviting for them to tell you if they're doing this. And if they do tell you, I wouldn't recommend putting, I don't know how you feel about this, but putting a hard stop on it, because they might feel like closed off to tell you anything again. But like open discussions and respect really helps.
Thank you. I have a feeling Dr. Tijani might have said something similar.
Yes, I would have open discussions and, sort of respectful discussions are key. We know that when there's discussions that are focused really just like on the harms of using the substance, or like when there is a lot of criticism implied around the idea of, that the substance use generally and that child's use specifically, that's not helpful. What does tend to be helpful is taking a curious stance, expressing an interest in what's going on with your child, what they think may be driving whatever sort of problem or issue that may have come to your attention. Really being a good listener is the most important thing. And when a child feels they have a adult who cares about them and is non-judgmental, is approachable, like that is goes so far regardless of what's happening, sort of around them.
Mhm. And I will say, for those of you who haven't been able to dive into the booklets, I know they're lengthy, but there's a lot more about relationship and conversation and communication in the Let's Talk and the Let's Start Talking booklets. And if you want to, there are recorded previous sessions, if you haven't seen them, that really do focus specifically on parenting to support our teens. And I think the takeaway tonight in mental health is our teens are going through a lot. And whether that means there's going to be a substance use disorder or not, or just experimentation or even none, but they're struggling, that what we have to fall back on is our relationship with our kids. And we have to build that relationship before they're in trouble, right? You can't build it the moment you realize something's wrong. We have to start at the outset, right? And so I think those are my final words for prevention strategy, right? Is start building that openness and honesty and authenticity early. Thank you so much to our speakers and to all of our participants and community members who are here tonight. There are a lot of resources that were posted into our chat. Books, resources, our post-workshop survey, please fill that out. So go ahead and click those links before we close down tonight so you can get to those. And more than anything, take care of yourselves, take care of your people, enjoy your summer, and we will see you back here in the new school year. Thank you all so much. We'll leave this up for a minute or so people can come into the chat and pull out any links they want, including that survey. Take care of y'all.